Good afternoon, my name is Olivia. I am also known as Olivia K on Facebook, Ollie K on Instagram, and Warmium 9800 on Reddit. So don't mind the noise. It is getting warmer out. People are driving out and stuff like that. And I love to record my car just because it's easier. So I usually talk about nursing related stuff and NCLEX related materials to help nursing students with studying for the NCLEX or going through nursing school. I also talk about reality TV if that's of interest to anybody, just as a way to decompress, because nursing's a lot and sometimes you need a break from it and step away from it for 2 seconds. But today's topic will be on safety and infection control. The reason I want to go over that, because when I am going over a lot of CPR reports, I'm noticing below the passing standard on safety and infection control, and you must be at least near or above passing standards for safety and infection, because NCLEX is a safety exam and you want to show them that you are a safe nurse. So it is very important to understand your PPEs and your infection control principles. So I'm going to start off with PPE. What is entailed with PPE? So that'll be your gowns, gloves, goggles, and mask. And there's usually an order in how you put it on. So you don it, or doff, you take it off. The order where I usually tell people to remember, Mark K also goes over this, so I can see if I can leave a link on how he talks about infection control, if I still even have the lecture, but I may leave it if I have it. But when you're putting on, you think of it as a ascending order. So you put your gown on first, your mask, your goggles, and your gloves. You can also sit down when you're taking the exam, and they may not ask you straight up, but you can think about it and you can do the sequence, and then it's going to make sense to you. So an acronym I usually like to say is good mothers get grapes. So which would be like I said, your gown, your mask, your goggles, your gloves. Now to take it off, you want to take the gloves off first, and then you take off your goggles, and then your gown. And I know before I go into the gown being taken off last, here's the thing: when you're taking care of a patient that has airborne or droplet precautions, you want to be able to take your mask off last, because if you're still in that room, there's a high chance you can get infected if you're still wearing that mask, or you're used to taking that mask off. That's your protection from the infection. So it's best that you take the gown first before you're taking off the mask. So the mask, you take that off outside the room. You can take off the mask, the gown rather, in the room. You leave, and then you take that off, and then you wash your hands. So another thing I need you to remember when you're seeing infection kind of control kind of question, and they give you choices of sanitizer or hand washing, always pick hand washing, because that's the best way to prevent any kind of infection spread. So just want to say my 6 cents for that, my 2 cents for that rather. I'm just thinking of the movie 6 cents for some reason. Okay, so an acronym I usually want people to remember with taking it off would be great grandmothers get milk, because masks will be last in this case, because of the fact you still want to protect yourself from the infection. Okay, so hopefully that helps. So good mothers get milk. Good mothers get grapes. Great grandmothers get milk. So I hope that helps you. Okay, so that's how I remember it. Now your precautions, right? I also have some acronyms that will also be helpful to you when learning the different types of precautions. So there's 4, but I'm going to just go over the 3 that you will be frequently asked. So there's your airborne, droplet, and contact precautions, right? So I like to think of MTV on air. That's what Simple Nursing taught me. He's so good with this too, so you can also check him out. I'll leave a link regarding his video as well. So MTV on air. So that's your measles, TB, and varicella. So before I go on further, do not confuse measles and meningitis, because that's what I did when I was studying for the precautions, and I needed that because that's what I messed up on when I did my first attempt. So measles, so meningitis would be your droplet. So that's the difference. It's so easy to get those two mixed up, but measles in this case for airborne. Then droplet. So actually, before I get to droplet, so with airborne, you want to make sure that the door is shut at all times. So that's the difference. The door has to be shut because you want to prevent the spread, and then you want to wear your N95 mask. Okay, so now droplet. So droplet is different because you can have it open, but the only thing is that you can still catch an organism within 3 feet. So which is why they should be they're supposed to be private or semi-private. Private would be preferable. So with that's you can wear your mask, and that I like to also call Spider-Man. Look, you can also look that up. I'm going to go over it real briefly. So that's your strep throat, pertussis, influenza, diphtheria, epiglottis, rubella, mumps, endenovirus. I'm sorry about my pronunciation there. And meningitis, so which I just mentioned. So again, don't confuse measles and meningitis. Okay. So for airborne and droplet precautions, if the patient is that's infected, that is being transported, they're to wear a mask during transport. And if you're suspecting these patients have these symptoms, you implement precaution as immediately as you can. Okay. So, as I just mentioned before, with both airborne and droplet patients, the mask must be taken off outside of them. So, which is why masks last. I know before, when I was first taught, the gown goes out last, but mask has to, because you don't want to be getting infection. Okay, you want to be inhaling it and catching it yourself. And hand washing, as I said, is always going to be your best answer. So if you remember all these principles I just said, you will improve with your safety infection control questions. And ideally, these patients, even contact, I'm going to briefly go over contact before I end this video. They should be private. So with contact precautions, it's either MRSA or C. diff. So CV for contact. So that's what also want you to remember. So with contact, they don't have to have their doors closed. Only with airborne. So contact, they don't have to wear a mask. So only droplet and airborne patients, mask for transport. Okay. And that's about it. I hope that really helps you. If you have any questions, leave in the comments, and I will link Mark Cave if I have the lecture. If not, I may not have it. So if not, you can also look it up on Reddit and look for Mark Cave lectures. And I know there should be links there if you do have I forgot, Google something. I forgot the name of it already. And then Simple Mark and Registered Nurse RN does go over your PPEs and precautions. So I hope that helps you. I hope you have a wonderful rest of your day, and take care. Bye now.